All right, South Africans are waiting with bated breath to find out if the national state of disaster will be lifted. The National Coronavirus Command Council is meeting today to discuss lockdown restrictions. President Cyril Ramaphosa announced during his State of the Nation address that the government is planning to scrap the national state of disaster as the country enters a new phase in the management of the pandemic. To discuss this further, we're joined by CSIR senior researcher Ridhwaan Suliman. Thank you very much for your time here on eNCA, Mr. Suliman. Firstly, is it time, really, what is the science saying? Is it time for us to scrap the national state of disaster?
Good afternoon, Ms. Eka. Indeed, I think the current data for COVID-19 nationally and across all of the province shows that the risk has significantly lowered. And I believe we're at a point now where we can do away with the national state of disaster currently. It is a risk-adjusted strategy, and with the risk having significantly reduced, I think the strategy, therefore, can also be adjusted accordingly. Importantly, our hospitals across the country are not at risk of being overwhelmed now. In fact, hospitalizations and deaths are approaching their lowest levels that we've seen during the pandemic. Furthermore, I think 2 years on since the start of the pandemic, our understanding of the virus and the way it spreads has certainly improved. And I think with the lower risk of infection and transmission, I think we're at a point where the public can be trusted and with the right data can gain agency to make risk-informed decisions right now.
What about the mask? I mean, other regulations have said that we don't have to social distance as much as we used to. Schools got back to full learning, no longer that rotational learning. So the mask, I think a lot of people, even after 2 years, people like myself, I certainly am not used to it.
Yeah, so look, we do know that COVID-19 is an airborne virus, and with good ventilation, the risk of transmission is significantly lowered. So therefore, I think in outdoor settings where ventilation is significantly better, we're probably at the point with the low levels that we're seeing now, at a point where we can likely do away with having strict mask regulations outdoors. I think in certain crowded indoor settings where ventilation may be poor, there may be a need to still continue in those settings, but where ventilation is good, I think we're at a point where we can probably do away with having mandatory regulations, but again, allow the public to make their risk-informed decisions based on their own individual circumstances.
And it's quite funny, actually, my sisters and I were laughing at the fact that you get into a restaurant, for instance, where there's a lot of people and it says no mask, no entry. But as soon as you get in there, the mask is in your bag.
Yeah, unfortunately, it's impractical or illogical to continue or to have regulations in those settings. Look, I mean, certainly the virus doesn't disappear when you sit down at a dining table, but of course you can't eat while wearing a mask. So there are contradictions in that sense. I think fortunately, though, as mentioned, the risk is significantly lower now compared to where we were a few weeks ago. And so I think we're in a much better position where the risk of transmission has lowered. And so we can possibly do away with the masks in certain risky, non-risky, well-ventilated settings.
All right. You know, a lot of South Africans, get freaked out when you talk about a wave, third wave, fourth wave, etc. What's the research showing you? Are we going to be okay if we lift the state of disaster? I mean, we already don't have many of the regulations that were put in place and we're doing okay. You were talking about the fact that our hospitals are not under as much pressure, etc. So I'm assuming we'd be okay, or are you hearing anything about the possibility of more waves?
Look, there remains a risk of future waves and further infection. The virus is not going away. The risk is currently lower due to high levels of immunity that we currently have. If we look at South Africa's epidemiological trajectory over the past 2 years, the 4 waves have been fairly regular, spaced about 3 months in between. Given that predictability or regularity in the patterns that we've seen in South Africa, it is expected that we will likely see a fifth wave or fifth resurgence 3 months after the end of the Omicron wave, which puts us towards the beginning of May. So as we head into our winter months. That being said, also, the 4 previous waves that we have experienced were all driven or dominated by a different variant. So a further or fifth wave is a new variant is necessary to become dominant and to outcompete the current highly transmissible Omicron variant for us to see a resurgence going forward. So I think that period of 3 months is sort of what we are predicting based on previous trends. But that being said, I think we need to understand that the previous Omicron wave was a change or shift in the pandemic, with high levels of infections being seen, but significantly lower severe outcomes of hospitalization and death due to high levels of immunity, both natural as well as acquired, but also a less severe variant. So the hope is going forward, we will, it's not a guarantee, but hope to see less severe outcomes of hospitalization and death, even though we may continue to see infections or surges in infections.
All right. Thank you very much for your time here on All Angles. That is Ridhwaan Suliman. He's a senior researcher at the CSIR.